Hey, everybody. Hey, Santa Fe. Hey, friends. Mayor Alan Weber here on a Friday afternoon in City Hall, wearing my mask because we're doing great. We're doing better, but we're not out of the woods. And we want to go from yellow to red. We want to go from yellow to green. So don't lose your focus. Don't lose your discipline. Don't lose your mask. Wear your mask. Practice those good hand sanitizing practices, physical distancing. We are making progress. We'll talk with Dr. Wendy Johnson from La Familia in a minute, but the important thing is stay focused, keep disciplined. Let's move from yellow to green, and now the governor's talking about green plus. So we'll get into that in a minute. Thanks for tuning in. My guest, again, as we love to have with us, our own Dr. Fauci, Dr. Wendy Johnson from La Familia. Welcome to the WebberCast, Dr. Johnson. It's good to see you. You are true to your word. You got a haircut. Let's take a look. Congratulations. You got out. And I think there's a little spring in everybody's step. The snow's been exciting. The sun is out today. Vaccinations are moving forward. There's still some frustration. We'll talk about that in a minute. But give us an update. Just let's hear what you're seeing at La Familia. What's the state of play? And then we got some things to chat about in terms of the vaccination situation and the supply as well as the demand. So update from La Familia. What are you hearing? What are you seeing? How's it going?
Yeah, well, from where we sit, I think it's going really well. La Familia is part of a collaborative group that involves several different collaborations, really. We're on several different work groups, teams that from all over the state that talk about how best to get the vaccines out, that involves the Department of Health and the governor's office and the other federally qualified health centers and hospitals in the whole state. We also have a weekly coordination with our county, and that involves the Christus and Presbyterian hospitals and the local clinics. And again, obviously the city offices, the mayor's office and the city, the county, and the Department of Health also. And then there's also other collaborations that we do just with the community clinics, all the federally qualified health centers in the state. So we are really working, and I think that's why New Mexico's effort has been so effective, is because we are collaborating and we're, the right hand knows what the left hand is doing, and we're all on the same page. And even though still, I talked about this big funnel, and the demand is like huge, and we have this like bottleneck right here, we still have small supply, and we really have to make sure we equitably distribute what we have. Even though that's the case, I think that we are doing a really good job, and all the statistics from across the country show that. I will talk a little bit about why people are frustrated, I think, and how we can, move forward. But what I want to reassure people about, or I want to tell people, is that a couple of things about New Mexico. We're getting a higher percentage of our population vaccinated than most other places. I think we're still number about 3 in the country on that. And we are also being very efficient about how we're rolling out vaccines. So some days, if you look at the numbers, it looks like we're giving more vaccines, over 100%, but that's because the number of vaccines we get are based on the number of official doses in each vial. But both for Pfizer and Moderna, you can actually get an extra dose out of there. And so we're getting that extra dose, and that's why for Moderna it's 10, for Pfizer it's 5 doses in a vial, but we're getting 11 or 6.
Wow.
And that's why it looks like we're giving more than we're getting, because we kind of are. And sometimes our numbers go above 100%. But we're right at the 99, almost 100%. As soon as we get vaccines, we get them out in the community. And we're going, the logic of the Department of Health strategy around vaccine distribution is to really make sure that the very most vulnerable get the vaccine first. All right, the people that are very most likely to get severe disease, to end up in the hospital, or even to end up dying. So that's why there has been some frustration because some younger people aren't on the list here, but they are on the list in some other states. And, but what I think what we're doing is, defensible on that basis. I think that we need to really keep an eye on equity though, also.
I agree. Let me give you some data. I was on, this week is a US Conference of Mayors virtual annual meeting. We don't get to, we were supposed to be in Austin or someplace. Well, I'm glad we're not in Austin right now, sadly.
Not Cancun? You weren't supposed to be in Cancun?
No, Cancun wasn't on the list. That's not in the, last I checked, that's not in the United States. But sometimes we go to DC or we go to a state capital. Austin's freezing right now, and my friend Mayor Adler is struggling, so our hearts go out to them. But there was a briefing today from a federal official in the Biden administration on the COVID task force. And I just thought I'd share a couple data points because we always worry about and we are concerned about the gap between supply and demand. That's what you talk about as the funnel. Well, what the federal official said was a couple things that's worth noting if you're listening or watching. First of all, the federal government is saying for the next, they know there's been a visibility problem. Dr. Johnson, you've talked about, every Monday you go down and it's Christmas morning and you open up your Christmas package to see how many doses you've got. They're saying next week and the 2 weeks after that, the federal government is saying for visibility purposes, 13.5 million doses will be dispatched to the states and the tribal nations. 13.5 million. It's a 57% increase over what they've been putting out. And they're able to say, according to this gentleman, week after week after week, for at least the next 3 weeks, that's the supply. So it looks like the hockey stick is moving in the right direction. They're also talking about the Johnson & Johnson vaccine, not named after you, unfortunately, but perhaps in the future, there'll be a Johnson & Johnson vaccine. No later than the end of June, if it gets cleared, 100 million doses of J&J, which is only a one-shot vaccine. And they're also talking about the federal pharmacy program going up from 1 million doses last week to 2 million doses in next week. So it sounds as if a variety of different resources, they know it's a supply problem, they're concerned, and they're going to provide both more visibility, more predictability, and just flat out more vaccine for states to get then distributed to folks like you in the on the front line. So that ought to be some good news for everybody, I believe.
Yeah, absolutely. To date, first of all, we're trying to ramp up. And again, just to be very clear, I just can't emphasize this enough to people. Everybody out there should make sure that they're registered on the Department of Health app to get the vaccine. When I talk about La Familia, we collaborate with other folks to get the vaccine out equitably. We're using the same criteria as the Department of Health. We are focused on our patient population right now. So only La Familia patients. So don't please call us if you're not a La Familia patient and go through the Department of Health app. I know Christus is also focused on their patients, but no matter where you are, the Department of Health app or who your primary care is, go to the Department of Health app, and then also let your primary care provider know, your doctor, your nurse practitioner, whoever that might be, that you're interested in the vaccine, because they might be affiliated with Christus, first of all, or Pres, and you might not realize that. I know Presbyterian Medical Services, which is the guidance center, is also giving vaccines to their patients. IHS is also giving vaccines to folks who are IHS. So if you're any of those categories, make sure and ask your primary care provider, because you might find that they're connected to one of those entities. But even if they're not, this is very good news, what you're saying there, because there are a lot of clinics, like Southwest Cares as an example, that has put in an order every week and so far hasn't gotten that order because there's not enough vaccine yet to bring more folks online. And also for ourselves, we're giving about 300 vaccines a week out to, again, our patients. And we really want to ramp up to giving 500 to 1,000 out a week again to our patients. And but we can't do that unless the supply gets loosened up a little bit, unless we get more supply. So I think what all that means is hopefully more vaccine will be pushed out from primary care providers. The Department of Health, we're talking about doing even collaborative events with Christus and ourselves and Department of Health, and maybe doing even walk-in events. We don't have those yet, but maybe soon, maybe even in the next 3 to 4 weeks, we could have that for certain groups of people, and that would really help, I think, also the equity issues.
Well, and you're a very good person to remind us of how far we've traveled, how fast. It's easy to say we don't have enough, and boy, we wish we had more. But if you go back a month, this is a large, complicated national effort. It's comparable or beyond what was done with polio in the 50s. Now we're looking at a vaccine that was made available at warp speed, literally, and works and appears to be very, very effective. There is a methodology for deciding a priority of distribution. The system is starting to get ramped up. It's still not perfect. I get emails from folks saying I'm 75 plus and I've got an underlying condition. I haven't gotten a call. I'm tempted to go to Colorado. I'm tempted to go to Texas. I guess you've been saying to people, get a shot where you can get a shot. I mean, it's important to get the vaccine, but let's try to play fair and play by the rules so that there is this feeling of equity. We don't just want people with funds to be able to get a shot, and people who are less well off don't get equal support from the vaccine and its distribution.
Right. I mean, I would say that I've heard a lot of anecdotal stories about people who are, very young and don't have any chronic conditions somehow being able to get the vaccine. I don't have any idea, not necessarily in New Mexico, but like you said, going to other states. And I would just ask folks to really think about that in terms of this thing that I'm talking about, that there are people in our community that still haven't gotten the vaccine that are at really high risk of death or severe disease. And when you are taking the vaccine, even if you're not in New Mexico, in another state, and you're a young, healthy person, you might think you're contributing to herd immunity and doing your job, but you're really taking that opportunity away from somebody who could literally die. I mean, I have a very good friend who both her parents died of COVID in January. They were in an assisted living situation, and they were slated to get the vaccine, and literally days before they were slated to get the vaccine, first one and then the other got COVID. It's tragic. It's super tragic. And, you don't want to be a young person without any chronic illnesses. You don't want to have literally that blood on your hands. You might not know the person that you displaced from getting that vaccine and ends up getting COVID and getting in the hospital, but that could definitely happen. So please respect these guidelines because they're there for a reason. Now, no matter what I say, I know that Colorado and Texas might have different age requirements. And, I've heard of people even flying to Anchorage, Alaska. People with means are going to do their thing, and if you're going and doing it within the guidelines of the state you're in, and the state doesn't care if out-of-state people come, I can't say anything about that. But in New Mexico, what we're trying to do in La Familia anyway, and what I would say to those people who are like in the category and haven't gotten the vaccine yet, is we're trying to reach out to those people. And you can also call that Department of Health phone number. So if you've registered for the app, or if you don't have the technological prowess to register for the app and you're over 75 and you're like, what am I going to do? Maybe you're not a patient of Christus or La Familia. Go call that number at the Department of Health, and they will get you connected to a vaccine pretty quickly. They will sign you up themselves, and they will probably get you an appointment pretty quickly for the vaccine, especially if you're 75 and older and haven't gotten the vaccine yet. They're really prioritizing those folks. And we are reaching out. That's what we see our role at La Familia is, really reaching out to the people who are not going to be able to get in that app, who are our patients, who are, maybe speak only Spanish, maybe don't even have insurance, maybe don't have access to computers or technology or smartphones. And we're really trying to have an eye towards that kind of equity as well.
That's great. Let's spend a minute before we have to call it a day. Talk about, we've spent a lot of time talking about physical health and getting a vaccine and being tested and wearing masks, continuing to be vigilant. We're also conscious of behavioral health issues. And people have been under a lot of stress for a long time, a lot of fear, loss of job, loss of livelihood, stress of family pressures. Um, I know you cared just as deeply about mental and behavioral health as you do about the physical challenge of COVID. And La Familia has been at the forefront of making sure people get those services as well. Can you talk a minute about how do we protect our community, not just from COVID, but from an outbreak of people struggling with mental health and behavioral health issues?
Yeah. Well, that's absolutely true, Mayor. We have, first of all, we're seeing an increase in overdose deaths, an increase in addiction. We're seeing an increase in homicides and suicides, not just in New Mexico, but across the country. We're seeing, in fact, I think the CDC just released the life expectancy, adjusted life expectancy. And it's not surprising, but our life expectancy has been flat or going down since 2010. So this isn't a COVID related thing, but again, because of COVID and because of the mental health effects and other physical effects, people not being able to get to the doctor's office for other issues, all this together, we're going to see an even steeper decline, I think, in the next couple of years. That's a result of the pandemic. And part of that is due to the mental health effects. And, at La Familia, we have an integrated idea about mental health and physical health. We see it all as the same thing. We have counselors and psychiatrists that work right alongside our family practice and internal medicine physicians. And so, we see it as all very, very tightly integrated, but that's unusual, unfortunately, in our healthcare system, where oftentimes behavioral health services are not as accessible for people. So I would say if you are struggling, if you feel like, you're on the edge, which I know a lot of people do at this point in the pandemic, reach out to your healthcare provider, reach out to friends and family, and or other services that are available. One place where you can find kind of a clearinghouse of where you can get connected no matter where you are in New Mexico is the New Mexico Crisis Line. And that phone number is 1-855-NM-CRISIS. So go ahead and call them if you feel like you don't know where to turn and you feel like you're on the end, at the edge and at the end of your rope. Go ahead and call them, and they have a lot of resources and a lot of support that they can offer. So we recognize that everybody's really suffering. I think and hope that we're going to be getting back to some kind of normal life soon. We all really need those social connections to feel good. And it's been a very big toll that we haven't been able to have that in a normal way in so long.
And here at the city and the county, we've got the Connect program. So if there's other issues, food or transportation, mobility, Connect is there to help as well. We are trying to get all of us through this together so that when the vaccinations are there and the economy starts to pick up, people go back to work, they've got a paycheck. It's not the way it was. It's not going to go back to the way it was. It's going to be a different future, but it can be a better future. It can be a future where the resources are applied more, to your point, more equitably, more fairly, where we prevent social problems instead of just accepting them as the norm. And so I think mental health, behavioral health, social support, we're at an inflection point here where we can really respond to people's needs. And you want to give that phone number again one more time, Dr. Johnson, in case anybody didn't get it the first time?
Yeah, the New Mexico Crisis Line is 1-855-NM-CRISIS. And another thing I want to acknowledge is that we've had a lot of death and a lot of really serious illness, which we don't even know the extent of right now. This long form COVID and the after effects, we're just learning every day more about that. And a lot of grieving in our community because of that. So I would just say to everybody in our community, be gentle with each other, be kind with each other. You do not know what other people are carrying. And so many people have been through such hard times. Like I said, my good friend who lost both her parents in January. A lot of people have had death and serious illness in their lives amongst their loved ones in the last year. A lot of people are really having a difficult time. So give space for that amongst your friends and family, and just, your grocery store cashier, the person at the gas station, whoever you meet in your daily life. Remember, we're all really struggling right now. So try to be kind.
That's great advice. Okay, last words of counsel. Wear a mask, be safe, get to green. What else? What else do you want us to know before we
Yeah,
call?
well, I would say around that last point, if you get to green, our numbers this week have been pretty great, except for yesterday. We shot up to 19, which 19, you go back a month or so ago, we were over 100. 19 seems pretty good. But in order for us to get from yellow to green, we've got to have our daily average below 12. So all of this week it was, except for yesterday, which was 19. We'll see what it is today. But what the danger is now is people are like, oh, it's gone. It's fine. Let me just go out and hang with my friends again. Let me not wear a mask now. And if you do that, we're going to go, as the mayor said, from yellow back to red. And I don't think anyone wants that. So if you could just stay the course for a bit longer, we'll get from yellow to green. So I'm really hopeful that next Wednesday, the governor will announce the new round of, colors. And I'm hopeful, if we don't see many more 19 days, I'm hopeful that we'll get back to green, and maybe to green plus. Maybe the governor next week will announce this idea of green plus and what that means. So keep at it, go be strong, Santa Fe, and let's get to green next week.
And be nice.
So, but we
I,
got
lo- I love your
nice.
I love your advice. These have been, it's been a year. It's been a year. We started this in March, and there's been remarkable strength and compassion and resiliency and love and community caring. But there's been a lot of pain and suffering as well. And hopefully as we come through it and get the vaccinations into people's arms, as this 13.5 million doses get spread out across America, and maybe Johnson and Johnson's vaccine, which is a one-shot vaccine, comes on. By the time we're into the middle to late part of the summer, then we'll have a chance to really breathe and have a celebration of life.
Yeah, I personally would like, Mayor, this is a request to you publicly. I would love it if we could get the bandstand, some kind of bandstand series back this summer safely. So, and then we can all celebrate together on the plaza.
I hear you. I hear you.
So see if we can get that. Let's work on that. Let's work on getting ourselves safe enough as a community that we can all go dance on the plaza again.
It's good to have some happy goals too, not just goals of reduced spread of COVID. I hear you, Doc.
Exactly.
All right, thanks for joining us. We'll see you again soon. Maybe we'll get you back next week if we can book you.
That sounds good. I'll clear my schedule.
Stay safe. Take care of yourself. Appreciate you. Bye for now. So great to have Dr. Johnson with us. She is so knowledgeable and so compassionate. We're very fortunate that she is the Chief Medical Officer at La Familia. We've got a great community health team here. Everybody from all of our facilities meet regularly, talk regularly, share information. I was talking with Christus yesterday. They only have 7 patients in their COVID ward at the moment, and more than half of those are from outside Santa Fe. So the numbers continue to be headed in the right direction. But as Dr. Johnson said, that only works if we keep working at it, if we stay focused. So let me remind everybody to practice those COVID safe practices, even if it's fun, yeah, go out, go to a restaurant that's open, sit inside, keep 6 feet apart, wear your mask, use a hand sanitizer, If you want to get a test, there is now a free home test, Vault Health. You can get it at home. It's absolutely free. learn.vaulthealth.com/nm. It is a free test to make sure you are COVID safe, COVID free. We have the Novid, Novid app that you can download to your smartphone or to your device to know whether you're in an early, whether you're near somebody. It's like a weather forecasting or a weather support device, letting you know who's near you, perhaps, who has tested positive for COVID. We're not done with COVID, folks. We still got to stay the course. Of course, our Connect program, santafenm.gov/connect can offer help if you need help. And the vaccine dashboard that the state Department of Health has put up. Just try searching for DOA, New Mexico Department of Health vaccine dashboard. Will tell you where we stand, where Santa Fe County is with vaccinations, how many doses we've gotten, how many doses have been put into people's arms. We still need to look after and take care of each other. There is a Food Depot distribution tomorrow at the Santa Fe Place Mall, 8 to 10 a.m. Thank you again, as always, to our friends at the Santa Fe Place Mall who continue to make their space available for the community to have a safe and convenient pickup for food. If you are looking to get some assistance, Food Depot does a phenomenal job. There was a fundraiser the other night, a virtual fundraiser on behalf of Food Depot. And I am told that it raised, hang on, I'll see if I can find the number. It was really a good performance. Let's see. Well, I wrote it down and I can't find it. But I do know that there was a terrific outpouring of community support for Food Depot and for helping to feed people. So good news on that front. Thanks to everybody who contributed and to all the meals that will be made available because of that good help. Other things to be mindful of: shop local. Last time we were together, we were able to show you that phenomenal video that Joe Abeda put together. Put your money where your home is. Keep doing that. Keep shopping local as our retail stores open up, as we move from red to yellow and hopefully to green. That's a chance to shop local and support our mom and pop shops, our small businesses. They're making it through COVID just as each of us is making it through COVID. We need to give them our support and our funding. If you'd rather shop from home and use the web, go to santafemarketplace.com. santafemarketplace.com lets you buy from local vendors and keep your money where your home is. And speaking of thank yous and shout outs, a great big thank you to the streets crews, the parks team, facilities. We had some pretty big snow this week. A lot of white stuff falling out of the sky and landing in Santa Fe up here at 7,000 feet in the mountains. It does happen. It's one of the things that makes this so beautiful as a home. It's also something that makes our crews get up at 4 a.m. and jump into those rigs and clear the streets and keep our drives safe and secure. So thank you to our streets crews, parks, facilities teams that really look after us. They don't ask for a lot of thank yous, but they deserve a lot of thank yous. Thank you to our crews that go out and pick up solid waste, navigating those big trucks through some pretty small streets and making sure that Santa Fe stays clean and safe. We are sure lucky to have employees like that. Makes Santa Fe what a great and wonderful town. Another coming attraction, Saturday, February 20th. This is Vital Spaces, our local nonprofit, another community art closet free art supplies for all folks of all skills and all age ranges at the Southwest Annex at the Midtown campus, 1600 St. Michael's Drive, from 11 a.m. to 3 p.m. You can go pick up art supplies for yourself, for your family, for your kids, for your neighbors. It is a great time to let your artist flourish. Get your art project on, and Vital Spaces will help make that happen. There's other good news. As Dr. Johnson mentioned, their ratings are out right now for vaccinations. According to one source, New Mexico ranks #1 in the nation as the state that has put more doses in people's arms for the doses that they've gotten than any state in the country. It's pretty much every drop of vaccine that comes to New Mexico gets put into somebody's arm to keep us safe. So big shout out to DOH for getting the vaccination into people's arms. We just need more vaccine. The more we get, the more people will be vaccinated. More good news for those of you who, like me, is a big baseball fan. The Fuego announced their schedule. Spring is coming. Baseball is not far behind, and we're all very eager to see that happen. For those of us who are big baseball fans, good news, baseball is on its way. That's about it for today. I appreciate everybody tuning in, listening, and certainly appreciate Dr. Johnson. When she's with us, we get really good medical advice, but also really good human advice. She is one of those individuals who is not only a phenomenal doctor and public health resource, she understands the human heart, and that's important. So thanks for tuning in. Thanks for watching. It's a weekend. Please enjoy the beautiful weekend that's in front of us. Remember to, when you go out, do what I do whenever I go to the supermarket, go to the pharmacy, put on your mask, wash your hands, practice social and physical distancing. Stay safe, keep yourself safe, keep your family safe, keep the community safe. Let's get that number down. It was 19 yesterday, but the days before that, 8, 2, 8, and 10. So bend the curve. Let's get it down below that 12 number, and we'll go to green. Next week, if we all stay focused, we'll be in the green. So until I see you next week, stay safe. Take care. Take care, Santa Fe. I'll see you next week. Have a wonderful weekend. Appreciate you.